let's proactively plan how we're going to handle Christmas. How are we going to handle this family party?
Oh, yeah.
How are we going to handle baby showers? How do we support one another in that rather than feel like we're against one another? Or how do we handle that so that it supports both of us?
Let me tell you about the birds and the bees and the flowers and the trees and the moon up above and a thing called love.
So I'm here with Monica Ashton. She's the director of maternal mental health at the Healing Group. And we're here to talk today about understanding infertility in pregnancy and loss. Thanks for joining us, Monica.
Thanks for having me, Braxton.
It's great to have you on the Birds and Bees podcast. So as we start talking about this, I really want to know more about how common infertility, you work with primarily, is all of your clients experiencing some sort of fertility or loss?
I work with a lot of clients that are experiencing infertility or reproductive loss or perinatal mood and anxiety disorders. That's a huge chunk of my practice.
Perinatal mood and anxiety disorders. Can you tell us a little bit about that?
Yeah, that's like postpartum depression, postpartum anxiety, postpartum OCD, those effects that can happen during that perinatal period, that's in pregnancy or after birth or after loss. Some people don't realize that you can have perinatal mood and anxiety disorders after a miscarriage.
Mm. So even after a miscarriage, you can have a whole array of emotions and even diagnosable issues.
Yes. Yeah. Wow. It can be really common.
Yeah. And how common is infertility? How common is pregnancy loss? Like it seems like it's not something that happens all that often, or at least people aren't talking about it.
That's the key. People aren't talking about it. It's actually really common, unfortunately. So infertility, it's impacting at least 1 out of every 10 couples. I've seen some statistics as high as 1 out of every 7. So there's a little bit of a range there, but it's happening to far more people than you probably realize. Pregnancy loss, the statistics are showing that about 25% of all confirmed pregnancies can end in pregnancy loss.
Oh, wow. So 1 out of 4 of every confirmed pregnancy
can result in pregnancy loss. Usually that's an early miscarriage, meaning you might have a faint line on a pregnancy test, but then you start your normal menstrual period. But it can be, I've heard some statistics even higher, especially when you're dealing with the infertility realm, because you're measuring far earlier than you would with any other pregnancy test because of the fact that you're pursuing alternative treatment to therapy or to fertility.
To fertility, gotcha. And is that... would you say that a lot of that is before the 12 weeks? I keep hearing this 12-week mark of don't announce it to people and you don't say that you're pregnant before then, almost like there's this superstition behind it.
There's just actually a higher statistic of pregnancy loss within that first trimester. That's where most pregnancy loss happens. So some of the things that people hear about are, statistically, once you've seen a heartbeat and it's at a certain rate, a strong heartbeat, you have less of a chance of miscarriage, which is true. The statistics grow more positive in your favor for continuing a pregnancy once you've had certain aspects, and especially once you're out of the first trimester. However, we still know tragedy can occur. Lightning can strike at any point within a pregnancy. Mm.
So it's not necessarily the go-ahead after 12 that, home free.
Yeah.
Okay. So let's maybe identify or define what infertility means.
Thanks for asking that, because I think there's a little bit of a misconception about that. And so I want to read you the actual definition from Resolve, which is a national infertility association. And the infertility is defined as the inability to conceive or carry a pregnancy to term after 12 months of trying to conceive. So that includes those with recurrent pregnancy loss that cannot bring a pregnancy to term. So again, it's inability to conceive or carry a pregnancy to term after 12 months of trying to conceive. However, after the age of 35, that time period is reduced to 6 months.
Oh, wow. So it even switches after the age of 35.
Correct.
And it's anyone, when you say to bring it to term, that means actually having a live baby. Mm-hmm. And does that also include if you have a baby and then you essentially never leave the hospital? Does it clarify on that?
No, once there's been a live birth, it's no longer considered infertility.
Okay.
Yeah, that's neonatal death or infant death, and so that's
Okay.
a completely different subject. But infertility is, you'll see some people that have what's called recurrent pregnancy loss. So perhaps they have miscarriage after miscarriage and just can never bring a pregnancy to term. That is infertility.
Oh, okay. And then when it comes to, so that falls under infertility. And then how common, essentially for men, for women, do you see that it's not necessarily fault, but where the man is not
Male factor
male
infertility.
factor?
Yeah.
That's what I'm looking for.
Yeah, so male factor infertility usually results in about 40% of the cases. Female factor also 40%. And then you have this remaining 20% factor where they say sometimes it's 10% combined factor and 10% completely unknown. We have no idea why this is occurring.
So you have two people that are like, well, they come back, sperm count, everything's fine. I mean, you should be able to
we've done all
conceive.
the tests, fallopian tubes are clear, and we just don't know why. So it's unexplained infertility. And that's a really difficult diagnosis to get because
Wow.
you're kind of in limbo land and making, educated guesses and trying treatments, and it's really frustrating.
Yeah, that sounds like that would be really frustrating to not have any answers and then to be left with, well, we just don't know why. So keep trying.
Yeah, keep trying, or here, we're going to do some interventions and see how you respond.
Oh, is
and
that
gather information from that piece.
Gotcha. So then there'd be even more tests or studies. You can become even more engulfed in the scientific world.
You usually, when you've been diagnosed with infertility, it's important to go and see a reproductive endocrinologist. Those are the specialists that really specialize in fertility treatment. So sometimes people stay with an OBGYN a little too long. I'm just really encouraging people to see a specialist once they've done that time period of trying.
And is that the 1 year?
Yeah, after a year.
After a year.
It's important to go and see a reproductive endocrinologist.
Yeah. So do you find that there's a common reaction to infertility, like from anyone that doesn't know why or understands that they can't conceive?
Yeah, distress. It's
Just
really
distress.
stressful. And the longer you're in the process and the more heartache and heartbreak you have, the more distress and stress and trauma you experience. It's a really difficult dynamic. Some people don't realize just how distressing going through fertility treatments can be.
Wow. What things might someone expect, or, as we're talking to everyone, what might we see come out in a couple or an individual that is just recently received a diagnosis of infertility to some degree or another?
It can be really devastating. Sometimes self-blame can happen, which is unfortunate. If it's male factor, female factor, sometimes people feel really broken, and it's a really difficult emotional experience to go through. I really encourage people to really try to reframe and see it as a couple's issue, that you're in it together. Not that it's his issue or my issue or our issue. We're both broken, but this is our issue in the fact that we're going to tackle this together. We're going to go forward together, and we're going to do this as a team. So it can feel really isolating, and it can feel really lonely, even if you're approaching it as a team, because sometimes you don't get that support. Infertility is a hard struggle to have, because it's not like other trials and difficulties that you have. It's really private and personal. I mean, you're taking, reproduction, which usually happens in the bedroom and is a very private, intimate experience, to the medical office. And then you have your aunt asking about your fallopian tubes and about your sperm.
Man.
And I mean, it really can be devastating with your privacy.
Yeah,
And so-
all of a sudden sex just becomes something that is
Medicalized.
calculated and
Yeah.
medicalized and timed, and exactly when you're ovulating, and it's time to,
And everyone else is in your business.
and everyone else knows when you're ovulating too, and they're in
Yeah.
your business.
And it can be really devastating because unless someone has gone through that experience, or you have someone that's really dynamically empathetic, it can be hard for people to understand just how distressing this is, because people get into solution mode
Solutions,
and trying to give you, oh, here's the latest book or the latest research. And that's the last thing you need. So it can be really lonely. It can be really difficult, and it can be really devastating, especially if you spend a lot of time in the fertility treatment world and things aren't working the way that you'd hope them to work.
Would you say some of the things that you'd see would be maybe old wives' tales of like how you should position yourself or foods that you should eat, things like that? Does that come across a lot?
It happens a lot in stupid comments other people make. And that's one thing that I advise is, they don't need to hear it. They know how to have sex. They know what they're doing. And I'm sure their reproductive endocrinologist knows far more about their medical history. And so that's one thing on the do not say list.
Do not tell them to eat ginger or
don't go there.
Don't go there.
If somebody's opened up to you and has expressed their heart and has shared this difficulty that they're having, the best response you can give them is pure empathy. Mm-hmm. If you don't know what to say that. I don't know what to say. I don't know how to help you, but I'm here for you. I love you. How can I support you? Teach me how I can support you. Mm-hmm. That's the best way to support someone going through this struggle.
Completely. I think a lot of the times what we end up seeing, especially in something that can be so uncomfortable as this, to hear, to be like, wow, this is really heavy. Immediately people want to move into fixing, like you just said. We really want to be able to say like, I don't know what to do, so maybe you're telling me this so I can fix this. So I'm going to try and come up with something or try and say something to make it seem better, or I'm just really uncomfortable with all this, and so I'm going to try and say something to make myself feel better, and we really need to try and stay away from that.
Exactly. And you realize that it comes usually from a good place, an authentic place, a heart of a helper. Mm-hmm. And so, you try to gently educate that individual.
Gently educate.
Gently educate them that, that's, although I know your heart's in the right place, that's really not helpful. And hopefully that person hears that. But if we can avoid some of those comments just from education piece, then that would be really helpful to realize, just because I'm feeling distressed and want to fix it, that's not the best comment for someone going through this.
Totally. And some of the things that come up specifically is I think of infertility, especially as someone is diagnosed where it's like, oh, it is your issue. For being a man or a woman, where you start to feel maybe loss of what it means to be a man or a woman, and where you can't reproduce, or, women are brought up and it's like, okay, you're going to have children someday if that's your choice. And men are like, hey, you can make children and that's kind of how things are supposed to be. And all of a sudden you're told you can't do that. There can be a real blow to the self, to how you feel and view yourself as an individual.
It can be a real tragic identity distress. And it happens a lot because we are biologically hardwired to reproduce. Mm-hmm. And so when somebody has that choice that they want to grow their family, build a family, and then something's not going right, it can be really difficult. It can affect sexuality. It can affect your relationship. It can affect your personal identity of what womanhood or being a woman is. It definitely can affect masculinity. Mm-hmm. A lot of men tie their ability to reproduce or their sperm count or things like that to feeling like a man. And so that's one thing that we really talk about in the therapy room, is really being able to reorganize that identity and realize that you are still very much a woman, very much a man, and that it isn't necessarily tied upon those things, and work through and process those issues and those struggles, because that does come up for a lot of people.
I find that when working with a trauma, which essentially this is,
yes,
in working with trauma, especially within the first weeks, months, years, it's real easy to think that my entire identity is the trauma, whether it's sexual assault, whether it's a pregnancy loss or infertility. You start to see yourself as like, this is all that I am. And I love that therapy helps work that into, this is a piece of who I am, but I also really love rock climbing. And I also really love so many other things that makes me a human, but it's really hard to get to that point at the first part.
It really is. And it's also hard because with infertility, it consumes so much of your life. Mm. And so it's hard to realize that there's other pieces of the pie, that this piece doesn't define you. And so, because time-wise, energy-wise, financially, I mean, everything about it consumes you. And so it can really expand that piece to feel like it is the only piece and that is the defining piece of you. And you're right, that's where working through that process in therapy really helps to kind of put that in its place and to make sure that you really are able to identify all these other parts of you, that you are still all these other things, that you still have all these other enjoyments and hobbies, and that's a huge piece of that therapeutic work. But it's really difficult just because of the sheer dynamics of the fact that you are in that office constantly and giving yourself shots daily and whatever your treatment protocol is, it's very mapped out and it's very much usually a part of your daily process. And then financially, it can be incredibly traumatic as well. So it touches almost every piece of your life. And so it can feel that way. But you're right, part of that healing process can be helping to redefine that piece and realize that even though this is a significant piece and is consuming my life right now, there are other pieces, there are other parts.
With you saying it consumes your life, essentially, how does this affect the intimacy part, where sex as well as the intimacy of feeling close to your partner?
It can be really difficult. It can be really hard because, now we've got ovulation predictors and we have timed intercourse, and sometimes we have medication protocols that destroy the libido or
the
create...
medication will actually take away your libido.
Sometimes it does. But sometimes you're on a medication protocol that puts you in perimenopause. I mean, you have a lot of really difficult medical dynamics going on, and it's taken, like I said, reproduction normally, if everything goes well, is an act between two people usually, and private. And now you've got, you're conceiving with a doctor and a nurse in the room, and you're in stirrups, and your spouse or partner might not even be in the room. And it really impacts a lot of different areas. And so that's one area that we really discuss as well, is that sexual piece and that relational piece and that sexual intimacy and connecting piece. Because if left unchecked, it can go down a really difficult road, and it takes a lot more time to get back to developing a pattern of connection between two people.
Yeah, it seems like it would be really easy for a couple to be distant and emotionally become distant and be in a place that you don't feel like you can turn to each other, because at the same time, like what we were just talking about, you want to fix it, and if a partner's trying to fix but doesn't know how, it can easily turn into just a distancing. I don't know what to do, so we're just going to not talk, or we're going to fight and create a fight around this so we don't have to have sex, or we don't have to deal with whatever issues happening and not feel this vulnerable piece.
Yeah, it definitely can happen. And I usually see one of two things. Usually either a couple really latches onto one another and grows closer and more supportive with one another, or it can drive a significant wedge. And those factors, can be based off of how the relationship was already going, how they've handled hardships in the past, or communication skills. It can be, family dynamics or fertility dynamics. A lot of different factors play into that, but it definitely can be one way or the other. But it can definitely be a huge wedge, and it can be really difficult with people because of the dynamics of just how difficult this is and how painful and personal. And oftentimes infertility can be one of the first major crises in a marriage or a relationship. And so it can kind of be the testing ground to how do we handle a major crisis within this relationship.
It's the first major crisis.
It usually is.
Yeah. And I really like what you said earlier about being, once you experience this, it's your experience. Essentially, there's not, once this happens, blank's going to happen. I mean, it sounds like a huge wedge. It could be closeness, and anywhere in between can be your experience.
Yeah, a huge variety. But those are the two polar experiences that I often see.
Yeah, the two polars, and then whatever goes on in between, right?
Correct.
When a couple is focusing I guess essentially when we're talking about all this and you're so focused on getting pregnant, or following the curriculum or whatever you need to do in order to satisfy what the doctor's saying needs to happen. Do you find that there's helpful ways to build intimacy, or are there ways that you recommend couples start to act or do in order to keep essentially the sanctity of this intimacy versus the act of getting pregnant?
Yeah, there's a few different things, I think universally that can be helpful. And obviously a lot of things tweaked based on the couple's individual experiences. But some of the things that I really like couples to do is to really define different areas, either within the home or, if you have an extra spare bedroom, maybe that's the room that we kind of reserve for our what we call medical sex, really trying to build the family, our fertility sex. Mm-hmm. And the reason I like a different environment even is because it helps to not bring some of those stressors into the bedroom, so that we have an environment that's nurturing and about connection. And we have an environment that, we can negatively associate with some of these other negative experiences. So if that's a possibility, I'm a huge advocate for that.
Wow.
If not a possibility, then we get creative. Mm-hmm. But I really like couples to be able to kind of define the difference so that it doesn't feel always mechanical and medical and robotic.
So staying away from not necessarily staying away from it, but being intentional.
Very intentional, defining the experience. Mm-hmm. And then when we're using sex for connection, really trying to make sure that the focus is not on the orgasm. It's not on those pieces of a quote unquote achievement of, good enough sex, but really focusing on that connection piece and however that looks for the couple. So we talk about, how do you connect? What have been some of the positives? Things like that can be really critical because sometimes at that point they're done with intercourse because that is felt really mechanical and very robotic. And so we kind of explore new ways of connecting. Maybe that's through some sensate focus practice and just feeling connection physically or with touch or, holding one another. Or maybe that's, exploring new sexual practices that feel more connecting. So really we kind of tweak that to the individual, but I really do like being intentional about that sexual experience.
I was in a group that you were in I think it was maybe a month ago, and I really liked the piece that you brought up about it doesn't even necessarily have to be sexual as well. Like we were talking sensate focus. For those that don't know what sensate focus is, it's essentially being able to, you start out with non-sexual touch. It is all about the tactile touching, focusing on the warmth, focusing on the, what you feel and the person receiving the touch. And you work your way up into sexual touch, and it's not about orgasm. It's not about, getting to a certain stage or a certain place. It's all about connecting and understanding and being with your partner. And some of the things that you came up with as well, that sensate was one of them, but I really like how you brought up like writing a list of what you like to do. So you write a list, your partner writes a list, and then you're like, wow, these are the things that we really like to do together. Let's make time to do those, whether they're sexual, whether they're not, going for a walk in a park, doing something to really take care of yourself and take care of the relationship.
Absolutely. Yeah, that sexual component is one piece. Mm-hmm. And, if that piece is feeling more mechanical and we really want to focus on connection emotional, then that's fantastic too. I definitely don't want to ignore that piece. Mm-hmm. I encourage enhancing that relationship in all of those 4 quadrants of spiritual, emotional, mental, and physical. And so really being proactive in your relationship is critical during this time. Being intentional in connection, really being able to identify what are some of the things that are difficult for us, and then coming up with solutions based on your individual relationship of how that works. Of, what do we need to stay connected? Mm-hmm. What are some of the roadblocks? what do we want to do to kind of go through this process hand in hand through this experience, rather than feeling like I'm alone, or I'm dragging you behind me, or we're kind of on two separate paths. I really love that visual of walking through the fires of difficulty hand in hand, and supporting one another side by side. So it can make a huge difference when you have that support of the other person, and you have a dialogue and a plan of how you're going to do that.
That is a powerful visual, because you do need to have a dialogue if you're walking through fire together. You can't start wandering off in different places. And it can be quite easy for couples to do that even without going through trauma, especially while you're trying to navigate a trauma. Being very open with one another and building that relationship and communication sounds very important.
It is important, and especially when you're going through a trauma. I agree that all couples, I'm a huge advocate of proactive planning your relationship, but especially when you're going through something traumatic. You can't just leave it up to fate and happenstance and, whatever happens. It really does have to be this proactive plan. And if one aspect's not working, that's fine. We just tweak it.
What would be an example of a proactive plan?
So oftentimes I'll sit down with couples and we'll go over what's going well. What are some of the strengths in your relationship? Because we want to highlight those. We want to continue to nourish and foster those strengths. What are some of the areas we want to work on? And then we come up with solutions for some of those areas. We do a lot of planning regarding fertility because, like I said earlier, it can really overwhelm and encompass the entire life. And so oftentimes it can overtake the relationship, where that's all you're talking about. And that's all your relationship is quote unquote about during that time. We want to make that back into perspective as well. We want to shift that back into the fact that fertility is part of the relationship, but it isn't everything. And so we identify those other pieces of the pie as well. And so we come up sometimes with some boundaries and some tools and ways to shift communication and set boundaries about, okay, let's set aside a time to talk about it. Let's go through this worksheet about how you feel about all these different types of treatments and things like that. Let's get the dialogue going. Let's proactively plan how we're going to handle Christmas. How are we going to handle this family party?
Oh, yeah.
How are we going to handle baby showers? How do we support one another in that, rather than feel like we're against one another? Or how do we handle that so that it supports both of us? And coming up with, when you feel like a team, it makes a huge difference with support. And there's a lot of difficult instances and a lot of difficult interactions and social events and things like that need to be navigated. So there's actually quite a bit of planning we do. And some people might be surprised about that. But once the dialogue starts going and we start writing this down, and I'm a huge proponent of writing things down, because once it's written and it's in plan form, then it's more likely to happen.
Okay.
And
since it makes it solidified.
Yeah. And then we can always amend it.
Nice.
It can always be changed. But then we have a plan. And that feels really comforting, because when you have it with trauma, you have a lot of aspects that are out of control. And so we try to control the things we actually can control. And that helps create that balance during that traumatic time.
Yeah, that sounds phenomenal, especially as you start to think of if you find out you are pregnant, all of a sudden immediately in your mind you start thinking like, oh, next Christmas I'm going to have this small child, and then you lose the baby or something happens, and then you don't necessarily think about it until it starts to happen. You're like, oh, my child would have been, and these are all the things that I thought my life would look like. And there's a lot of grief and loss that comes up for that.
There's a lot of grief and loss with miscarriage. There is, and some people minimize that, thinking that, pregnancy loss is not as dynamic, but it really is. It can be incredibly dynamic and really painful. And you're right, there's a lot of markers in our lives, a lot of markers, holidays, birthdays, due dates, things like that are dynamically impactful, and it can be really difficult.
Yeah. So we've been talking a lot about how people can take care of themselves, and it can sometimes seem as though we're saying like, okay, make sure you're going to take care of yourself and have this plan. How easy is it for someone to want to alienate themselves?
Well, it can be really easy because it can feel really lonely and isolating. And oftentimes, friends and family members can really not get it. So in those scenarios where you don't feel like the people around you really understand or are able to support you in the way that you're needing to be supported, it can feel very isolative. People can start to withdraw from some of those social situations, so it can feel very lonely.
Yeah. And really, the family and friends probably don't get the emotion that you're going through. Maybe let's talk to how couple or how family and friends can best respond, or how they can be supportive. Like, what can they do?
Number one, invest in educating yourself. Invest in getting on good resources to read about the impacts of infertility. Get on resolve.org or the ASRM's website, the American Society for Reproductive Medicine. Turn to legitimate resources that might have information about how you can best support your loved one. The other thing is ask them directly. It's a hard, so many people feel scared because they don't know how to help. But if you can approach somebody with empathy and, like we mentioned earlier, if you don't know what to say that. I don't know how to best help you. I don't know how to best support you. What can I do to support you in this? How would you like me to respond to this? Do you want me to ask about your fertility appointments? Do you want me to be involved? Let me know when you want me to back off, because things might change. Maybe they want you to be super involved in the beginning. And if things aren't working out well, maybe they need you to back off a little bit. And for you to be understanding that even if you don't get it, that's okay. To really support someone is to respond to their needs and not yours. And sometimes people have a difficult time with that because, again, distress, they don't want to feel distressed. They don't want to sit with pain. A lot of people in our society have difficulty sitting with pain, and so they get into fix-it mode. Well, if I can just make this better, if I can just help them get pregnant, then I won't experience that pain. And some people don't even have that insight that that's what they're doing, but they're just responding to this emotive experience. But I really think turning to that person and asking, because it's different. Some people do not want to be invited to the baby showers.
Yeah.
A lot of people don't want to be invited to baby showers. That's really painful. But I have had a few clients that feel hurt when they aren't. And so you really don't want to overgeneralize everyone, but maybe having some idea that maybe this could be a tender topic.
Yeah, that's one of the questions that I've had a lot of people ask me as I'm a sex therapist. They say, well, I've got this friend that can't have kids. Do I invite him to these baby showers and things like that? And I haven't had much of a response other than like asking them. Would we go back to that as well?
Exactly. I think gently approaching them, saying, I realize that this could be really tender for you. And if you would like to attend, how can I help support you in this? Because I realize what you're going through is extreme trauma. Or if you don't want to attend, I still love you. I care for you. I understand that. And I won't see that non-attendance as anything negative towards me.
And I like how you put out too that as you build your contracts or as you're talking, this is the same thing as you're talking with your friend. Allow for an amend to be happen. So they're like, yes, please send it. And then they're like, yes, I will go. And all of a sudden, 2 hours before, they're like, you know what, I can't. I mean, it could change so quick.
Yep. It can change quickly. And someone that's ready to support is not making it about them, but realizing that that person's just in pain, and supporting them through that is the best gift you can give someone. Understanding, and even if you don't cognitively get it, that's okay. They're suffering, they're hurting, and it's okay to, and it's extremely loving to extend that. That's okay. I love you. I want you to, I don't want you to suffer. And you're right. Some people just want the invitation and want to send a gift. It really depends on the individual, and then being flexible with their emotive experience. There's something so profound with someone that's willing to love someone well like that.
It sounds like a lot of the questions that I had about what friends and family can do really seem to come back onto, when in doubt, ask the individual and be flexible.
Yeah. Ask the individual, but then don't argue with them about it. I have a lot of people where they'll ask, how can we support you? And they'll give an answer, and then they don't like that answer and don't want that to be the answer. And then try to convince them that that's wrong.
Ooh, that's not, I would say that's not the best.
It's not the best. And so when you're asking, if something's hard for you to understand, take a deep breath, take a step back, and then, tell me more about that. And so that it's not about your automatic response, because, some things are hard to hear. Maybe they can't be around you because you're pregnant. And even though that may feel really painful, or maybe someone within your family's pregnant, so they're gonna miss some family dinners or some family events. And rather than showing anger towards that person, which would just create a bigger wedge, trying your best to be understanding, even if you don't get it. That's really important.
That sounds very important. It really checking in with yourself. Sounds like friends and family. If you can check in with yourself and understand that if you see your actions trying to fix it, step back and realize it's not about you. And then really taking a step into all these things. I may be feeling hurt, but I really need to be flexible for this person, this individual that I love.
Yeah. Being flexible, being patient, realizing that their timeline may be different. We don't know how long treatment's going to last. We don't know how long they're going to be in pain. We don't know all the dynamics, and shouldn't. A lot of it's very private. And so we can't assume that we know what's best for them.
Totally.
And even though it may be disrupting this ideal image of how you'd like things to go and how you'd like your family dynamics to be, or how you'd like your friendship to be moving along, it's taking that step back and like you said, checking in with yourself and giving them room to process how they need to, and to ask for the support that they need to. And it can be difficult because a lot of friends and family that don't have a reference to infertility don't understand how dynamically stressful this is. One thing I think is critical to bring up, there was a research study done by Dr. Alice Domar that explored the amount of distress that women going through fertility treatments were experiencing, and compared and contrasted it to other dynamic traumas, cancer treatments, going through cardiac issues, things like that. Wow. And one of the things that she found was that in this study, specifically to women going through fertility treatments had just as much distress as women going through cancer treatments.
Wow.
And that's one of the things I usually lead off with, telling people, and I think I do it just to validate the dynamic distress they're experiencing. And so often family and friends really don't understand that dynamic. And they'll say that people are overreacting or being too emotional, or, accuse them of all these horrible things, which you would never say to somebody going through cancer treatments.
No, stop. It's not all that big of a deal.
Yeah, you would never say things like that. And when I educate family and friends sometimes about that dynamic, sometimes they want to push back on that, like, oh, it can't be, but it is. It's traumatic and it's difficult. And you also have the added effect that no one around you knows about it unless they're informed of it. Unlike cancer treatments, where sometimes there's some physical outward signs that this person's really struggling and going through some dynamic traumas, there aren't those signs with infertility. So you don't have people rallying around or treating you gently or doing some of these things. And so that can be a difficult dynamic. So that's one thing I like people to keep in mind is this is distressing. It is really impactful emotionally, and it is very traumatic for the couple. And so sometimes when I express that, or sometimes people get that aha moment of, oh, okay, it really is that difficult, that empathy can kind of well up, and they can respond in a better manner to someone that's going through this. Sometimes not, but hopefully that educational piece can help people really check in with themselves about extending more empathy, kindness, and compassion.
And I really think part of that comes into when asking yourself, is it an appropriate time to or is it really your business to ask someone if they are thinking of having a baby or when they're going to have children, especially because of how private it is? And to go back to the very first of the podcast, what did you say? It was 1 in 10 experience?
Yeah, Resolve's website says 10%.
It says 10%.
And I've seen other statistics as high as 1 in 7.
It's 1 in 7. And then what was the 1 in 4?
That was a miscarriage.
Miscarriage. So on top of adding all of that together, so we've got from 10% to 1 in 7, and then how 1 in 4...
1 in 4 to 1 in 5 pregnancies.
1 in 4,
25 to 20%.
that have a miscarriage. So there is a high chance that the person you're asking has experienced a miscarriage, is in the middle of the year of experiencing infertility and not quite sure why things are not rolling through, and asking a simple question such as, when are you going to have kids? Or don't you want kids soon? Like, why are you guys waiting so long? An individual is probably not going to be like, well, I've had this many miscarriages, or, you know what, we've tried for 8 or 9 months.
Or 8 or 9 years.
And it doesn't create conversation around it. And really check yourself on why you need that information. And if you really want to talk about having kids and things like that, maybe bringing it up in not a nonchalant way and really trying to connect with someone in a different way. So I guess maybe that's my soapbox.
Wise advice. Yeah.
Because it seems to happen far too often. It's one of those like, hey, I'd like to invite myself into your sexual world of when you're going to reproduce.
Yeah, and again, it usually comes from an innocent, naive place.
Yes.
Where someone has not dealt with that before. But those that have gone through reproductive traumas understand that that's a really tender question. Mm-hmm. And sometimes that person's not willing or ready or does not want to share that tender piece with someone. And so you're right. Tread lightly.
Tread lightly.
Tread lightly and be very conscious of why you're asking that question and that relationship dynamic.
Yeah. A lot of it is being, again, intentional. Mm-hmm. Like, what's the intention of the question? And yeah, what is coming up for you in any of these situations? And that's how you can best support and avoid some harmful conversations.
Yeah, some really hurtful ones.
Yeah, some hurtful ones. So what, in light of being educated and going and educating yourself, you said that there's resolve.org. Mm-hmm. What was the other one? There was AW...
The ASRM, the American Society for Reproductive Medicine. They have 2 websites. One is for professionals. I'm a mental health professional of the ASRM. And there's also a website for individuals that are going through fertility challenges. Both excellent resources because they have empirical data backing up their information. It's not, there's a lot of blogs, a lot of information out there, a lot of misinformation. I really like turning people to accurate sources. And then from there, they also have a lot of great bibliographies and resources of books that they would recommend. So you're reading good information, good research, good books written by mental health professionals of the ASRM, people that have really done postgraduate work and understand the dynamics of infertility and reproductive loss.
That's wonderful. And I love resolve.org as well. They've got a lot of PDFs, these 5 to 10 page of topics that you might want to know, like how does it affect sexuality? How does it affect, couples? And if you want to educate yourself about how to best approach and what maybe someone's going through, there was a PDF on there that I really liked that was about how you can respond and when a loved one is going through infertility or pregnancy loss.
Yeah, excellent resource for family and friends.
Yes.
They have a whole section just for family and friends.
Just for family and friends. So get on there and educate yourself. What about, so you hold a group here at the Healing Group for pregnancy loss and infertility.
Yeah, so there are 2 different groups. I have one group for pregnancy loss, and then another group for those going through infertility, and it's a mind-body group. It's a group that's not just processing, but also skills that will help create that balance that someone so desperately needs when you're going through a trauma. And so we actually practice and utilize some of those mind-body skills that have been empirically shown through Dr. Domar's research that we had mentioned earlier. She's the one that did the research about the distress. Well, she's also done great research about, so then what? What can we do to help balance out that distress? And it's based off of her work.
Wonderful. And is that does that happen weekly?
So once a month. We meet once a month. And if you're interested in finding out more about those groups, then contact us here at The Healing Group. Hop on our website at thehealinggroup.com, and you can find out more information. And if you are interested in those groups, usually I have a quick phone call with someone and get you the paperwork you need, and you're welcome to join those groups. Both of them are free.
Both are free groups.
Yeah, there's lots of different resources, lots of different books, lots of different resources. There's some great peer-led groups through the Utah Infertility Resource Center, and those are peer-led, so peer-to-peer. That can be really impactful and helpful. I do individual counseling with couples and individuals specific to both, all aspects of maternal and reproductive mental health. There's a lot of different tools and a lot of different resources that can be dynamically impactful. There's a lot of support online. There's some great online support groups. There's so much out there that I think people don't realize. Mm-hmm. And so, anybody that's interested in additional resources is more than welcome to contact me. And
wonderful.
And, from acupuncture specialists that specialize in infertility to perinatal massage therapists. I mean, there's just a huge resource of professionals that are there to support you.
That is so great. And again, you can contact her through thehealinggroup.com and Monica at thehealinggroup.com.
Yeah, that's my email address.
That's your email address. Mm-hmm. Thank you so much, Monica. Is there, if we could try and sum all of this so much wonderful information up, what would be the takeaway message that you want people to know?
The takeaway message I'd want them to know is that if you are struggling with infertility or reproductive loss, that you're not alone. And there's no reason to be isolated. There's a whole group of people, both peers and professionals, that are here to support you in this journey. Then it's really difficult. You're not crazy. You're not broken. We're here to support you. And for family and friends, hop online, educate yourself the best you can, and have some of those really tender and deep conversations with that loved one about what they need for support and how you can best support them. Create bridges and really try to extend that arm of love and compassion towards them, because you probably don't understand just how much pain they're in. So I really want people to understand that so that they can just be a little bit more compassionate, a little more empathetic, and also self-compassionate.
Self-compassionate. That's wonderful. I love that. Thanks so much, Monica, for joining us here on Birds and Bees Podcast.
Thanks so much for having me.
This has been another episode of the Birds and Bees Podcast. Thank you for tuning in. If you have any questions about the show, comments, or questions you would like addressed in another episode, please give us a call at 385-449-1818. Leave your voicemail and your question, or you can also email us at birdsandbeespodcast@gmail.com or visit us online at birdsandbeespodcast.com. We appreciate your support. We hope you enjoyed the show. Thank you for listening.